All right, thank you. So, perfect. And you will put up the PowerPoint, right?
If you click on that 1249 at the top of the screen there, Jack, uh, you see it now?
Okay, there we go. That's better. Thank you. Well, hey, good morning to everybody that's not on East Coast time. Good afternoon to everybody that is on East Coast time. Hope you're holding up well during this time period, and hope you're being as safe as possible considering all the things that you have to do on a daily basis. Um, Hey, a lot going on, and I would also I don't want to forget this at the end. We have done an awful lot of free trainings that are recorded. The links are on our homepage, llrmi.com. Feel free to utilize those as you see fit. We do a lot of online training, but during this time, we put those links out. There's no charge for them, and there are some materials that go with them as well. This morning, I pulled numbers as of the 13th, which was yesterday, and the total cases of confirmed COVID-19 is a little over 500,000, and total deaths of 21,942, so almost 22,000. I also read a news article this morning about some NYPD officers who had passed related to COVID-19. So this is having an impact on everyone. Obviously, things are better, perhaps because of the things that were quickly put into place with the social distancing and even just hand washing. My hands are, I don't know about anybody else, but my hands feel like they're going to fall off. I'm washing my hands so much. Um, things are better than originally predicted. So I think that's the good news for everybody, including our first responders. I think that first model out of the UK indicated that somewhere over 2 million Americans would die as a result. That number then dropped to somewhere around 200,000. And then that number now has dropped to about 60,000. So things are better than they were. And that's the good news. But we still have a lot of functioning to do, and we still have weeks to go. And to be quite honest with you, I think some of the things that we're doing now should probably carry over, particularly some of the hygiene things for our first responders. We should always have the personal protection equipment available. Uh, you know, we do have some similar experiences. And when I say that, during my time as a police officer, was at the beginning of the AIDS epidemic, and when we had IV drug users, was a constant concern for law enforcement. We knew very little about how you contracted it and how contagious it could possibly be, and what the methods of transmission were. And I can tell you that at that point in time was probably the first time that we started wearing latex gloves at times, particularly if we were dealing with somebody that was bleeding or had some other bodily fluids that we were dealing with. So again, this is not new. It's just new in the sense that it's a long-lasting and wide range set of factors that have come together. Um, so I think there's some things that we should think about right from the beginning of how our business operates. One of the things that I think is important is that our 911 centers, one, we got to protect our dispatchers and our communications people as well. So obviously, when we start talking about cleanliness in the workplace, we want to make sure that they're protected in that way. But I think from the standpoint of the way law enforcement operations work, one of the first things that happens is a call comes into 911. Now, one of the things that's happened over the last couple of weeks is that the U.S. Department of Health and Human Services has come out with an opinion and some direction, if you will, that HIPAA does not apply to the sharing of information with first responders on issues of COVID-19. So basically, what Health and Human Services, one of the examples they used was that a hospital or a local health authority could share information of addresses where people were confirmed COVID-19. And again, such a list, if available to 911 or to dispatch, would then alert an officer before they were ever to respond, and also for EMS as well, would alert the officer that, in fact, they should be wearing their safe personal protection equipment even while going on a call. Now, I know a lot of agencies are wearing personal protection equipment now on every call, but the fact of the matter is, you might even take some heightened steps, some distancing, things of that nature. Having EMS respond with you, if depending on the type of call, if you had this alert in place first. I do think, there's old case law, and one of the old case law cases on a civil rights lawsuit was this Doe versus Borough of Barrington. It's an old case, but it does go back to the AIDS issue, where officers responded to a call of a disturbance, and when they went into the call, they came outside, and a bunch of neighbors were standing outside, and the officer said, "Hey, I'd stay away from those people. The father's got AIDS." And the next thing you know, that made it to the school. People were keeping their kids home from school. And ultimately, the family, who was stigmatized, um, brought a lawsuit against these officers. Now, I'll tell you, the officers got qualified immunity in the lawsuit, but the court did say, there should not be this public dissemination of information. So I think one of the things that we came up with back then was a dispatcher might put over the radio something like universal precaution, so that people listening to the scanner, we weren't identifying what the issue was, but we're letting the officer know that they should take precautions when they go to the call. So I think some type of non-stigmatizing code is a good thing to do, because we don't want public dissemination of information that may stigmatize someone. Although I don't think this particular pandemic is of the same type, that people would feel stigmatized, because this is touching virtually all aspects of society, and there's certainly no um, behavior associated with it that is stigmatizing, if you will. But again, this information, because it is private information, is on a need to know basis, and as such, we should be cautious with that information. We're seeing a lot of agencies around the country that are screening on not just calls where there is an issue, but on every call. So as this pandemic has moved on, we see dispatch asking on calls, is there anybody in the house that has a fever? Anybody with breathing issues in the house? Anybody with a cough? Anybody with flu-like symptoms? So that the officers can be made aware. If the person responds, yes, in fact, they are, then obviously that's an issue. I can tell you this, believe it or not, this morning I had somebody come in who's an essential worker to work on my stove, because my stove is having issues, and obviously with no place to go out to eat, I had to have a little repair done on my stove. And the first thing that I was asked, I got a screening call late yesterday to ask if I wanted to cancel the call because anybody was sick in the house and all those things. So even in those cases, everybody's doing screening on this, and law enforcement shouldn't be any different. We should be doing some level of screening so that we know whether or not there's an issue. And again, we see a lot of agencies do this. These are just I pull some of these out of some policies and cut and pasted them into both trainings that I've done, as well as this PowerPoint, you know. And again, it wouldn't hurt to even ask whether the person or anybody in the house has had COVID-19 or been tested for such. There's a lot of people that are under quarantine waiting for an answer. One of the members of my family is a pharmacist that works at a hospital, and she was not feeling well and got tested. So for 3 or 4 days, she wasn't sure whether she did or she didn't. So we might want to even ask whether or not the person was in fact tested. One of the big things that's happened in law enforcement, and I don't think we should necessarily advertise all of this, is we want to limit officer exposure. One of the concerns, and again, things seem to be good the last couple of days. We seem to have flattened out the spike, at least in some of the major places. New York is reporting that things have seemed to, even though their death toll is going higher, that some of the spike is flattening. So that's a positive. But one of the things is, to continue this, we should be limiting our response to calls. There's been theories on law enforcement that have been around for years. I can remember going to crime prevention class years ago, and they talked about, how do you free up officer time? And one of the methods was to have self-reporting over the phone and not requiring officers to go to calls where there's no evidentiary issue that needs to be recovered, where there's nothing going on in progress that needs to be recovered. And really, in many cases, and this is true in our business, we're taking reports for insurance purposes. We're taking car accident reports largely for insurance purposes, particularly when no one's injured. We're taking, property damage reports and even some theft reports where there's no solvability factors. And so one of the suggestions is that, and this was back then, was take these calls over the phone to free up officer time. Hey, I think in this event, we think about that a little differently. We want to take those calls over the phone to limit person to person exposure. So again, as many calls as possible, we want to do that with. Obviously, one of the things we suggest is limit response to serious calls where somebody might be in immediate need. Rapes, robberies, arsons, assaults, domestic assaults. Even, I mean, at some level, we do have to respond to some in progress property calls. I mean, obviously, we don't want to see a situation where people start looting and nobody from law enforcement is responding. So there is going to have to be some common sense applied to this, but again, a limitation on response cuts off this exposure. Remember that one of the things that we're trying to do with this thought process is we're trying to make sure that when the serious calls come in, we have enough law enforcement officers available to take those calls. If all of our officers are in quarantine, all of our officers are sick, then we're not going to have the people available to take those calls. And so we're in some sense occupationally trying to flatten this curve as well, and any kind of spike. Now, one of the things we have to consider in call response is backup. And I worked in a place where we were very fortunate. We run with a minimum manning clause in our contract. We have probably 40 cars on the road in 19 square miles, 24/7. And if you get a good disturbance call, you'll have a lot of officers show up. Well, a lot of officers showing up may even be to a call where you don't need a lot of officers. It might be a call that really one or two officers would be sufficient, but you might have 5 officers there. So think about that from the standpoint of 2 things. First thing is that that's 5 officers now, or 6 officers that are in contact with the complainants, the witnesses, et cetera, to this call, whatever it may be. And if any one of those complainants or witnesses at that call turn out to be, um, you know, infected, if you will, then in fact those officers have now been exposed, and now it's not the 1 or 2 officers that were necessary for the call, but now it's also the rest of the officers. The other thing to think about is when we get 5 officers together at that call, then the issue becomes that if any one of those officers has been exposed and is infected, then that officer is then in close proximity to these other officers, and that's potential exposure. So again, we're really trying to cut down all this exposure, and the method of doing that is to do some limitations. The other thing we have to think about too is you know one of the things that backup officers can do. I happen to be walking through an airport when this thing first started to break, and an officer at the airport had somebody stopped in the hallway. There's a lot of people around moving from plane to plane. This was I think March 18th, and I noticed an officer standing like probably 8 to 10 feet away across the hallway while this one officer engaged the person by themselves. And I realized after that what was taking place was that officer was maintaining distance, and still acting as a cover officer and available should anything happen, but maintaining distance to do so, to limit that officer's exposure. So again, one of the things we can talk about at any kind of roll call training or anything like that is how do we manage and look at this backup issue as well. The other thing is we have to consider use of force issues. You know, again, we don't want officers to have to go hands-on in a long involved struggle with someone, although we know that may in some cases become necessary. We don't want that to happen because if that person is infected, then the length of exposure, the close proximity, the potential for bodily fluids to be exchanged, all of those things put officers at risk. So, to the extent possible, we should be talking to officers as well about how do we avoid these hands-on issues. And again, it's a combination, even search and arrest. So again, one of the things that we think about is cutting back on arrests. I was talking to my nephew, who's a police officer, and he said, just the proactive work is tremendously down because that's what the agency wants. And I think that's a correct approach to take. Again, are there ways to deal with this down the line? Yes, we can always get warrants with people and seek their appearance 2 months down the line. We can cite and release, on any kind of stop, rather than taking a hold of the person's license. Have them hold it out and take a picture of it with your phone, so you don't have to touch their license and whatnot and their documents that you may need to deal with later. But again, remember that an arrest brings about exposure because the officer is going to have longer contact with the person. The officer is going to have to move in closer proximity to the person. Uh, to the extent that the person could possibly be an exposure, the officer then, if it's a custodial arrest, is taking the person to jail. So that exposes the jail staff to the potential for exposure. That then potentially exposes inmates and anybody else that works at the jail to exposure. So there's a wide range of effect based on every single arrest that's made or anything that occurs that potentially is a domino effect, if you will, and an exponential domino effect. Each person carrying the virus can expose a number of people. So we want to minimize that. And one of the ways we do that is cutting back on some of the proactive things we do. And I think one of the things to recognize is there's a lot of proactive stuff that occurs in law enforcement. A lot of traffic enforcement is proactive. A lot of your narcotics investigations are proactive. And again, I'm not suggesting that we let the community run wild. That's not the suggestion, but we've got to think about how do we make sure that law enforcement is available when somebody is endangered, particularly in these more serious events, and we don't have all the officers quarantined because they've been exposed. So again, those are some of the issues there. Along these same lines, there has to be a balancing. Um, right now, I went to the supermarket, I don't know, last week, and I said, let me go first thing in the morning, get this out of the way. Believe it or not, I put a mask and gloves on, and actually it was a bandana. I kind of looked like I was going in to do a robbery. And I get to the market, and there is a line outside. They're letting people in a few at a time and then putting people out because we have in Rhode Island that a store can only have up to their 20% of their capacity. So the store had a count on their capacity. And there was a police officer outside. And that police officer was ensuring the enforcement of the emergency orders of the governor that says not more than 20% of capacity in the store. And also, I think, to make sure it was orderly in the way people went in. So we've got officers assigned, in some sense, to do that. We've got to balance that. We've got to balance that against our regular law enforcement operations because nothing's going to stop the murders from taking place. Nothing's going to stop other criminal activity, assaults, domestic assaults. In fact, I'm reading some figures on domestic assault that it's up dramatically high. The Up here in Rhode Island, the local director of our domestic violence advocacy office was on TV just last night and talking about the fact that, and it makes sense. You don't need to be a rocket scientist to figure this out. Is if you have a domestic abuser who's now locked up and with his uh, continuous victim, then the victim is at greater risk because the abuser is not leaving to go to work, not leaving to go to the bar, not leaving to do everything. So again, we're going to have our regular law enforcement operations that have to continue. So we have to make sure we have a plan for doing that. So that's part of the balancing that goes on. You got to have sufficient personnel for operation if quarantine does become necessary. You know, one of I saw a department the other day that had actually separated their department into two distinct police departments. Think about that. So what they did was they took their mobile command center, which is quite large, and they put it at one end of town. And half the department no longer reports into the police station. They report directly to that mobile command center, while the other half of the department reports to a different captain in the police station. And the theory behind that is now the officers are not intermingling, so that hopefully both sets of officers separated will always leave at least one set of officers not in quarantine. So if we have a whole group of officers that get exposed and potentially get sick, then we'll have this other police department right within our community that can kind of take over. So again, that's just one idea. Smaller agencies, and hey, more than 50% of agencies in the country, I think it's 48% of agencies in the country are less than 10 officers. So what do you do if an entire agency or even half of a 10 officer agency becomes under quarantine for potential exposure? Again, I think this is a time when you got to make sure that you have proper mutual aid agreements in place. You've got to have other agencies that are willing to pick up the slack and handle things for you. And we've got to be very, very cautious about how we accomplish that, because public safety still takes place. I do want to talk a little bit about enforcement of emergency orders. There are all kinds of orders in place. Um, it's interesting in my mind. It's interesting that virtually every state has state law that allows the governor to declare a state of emergency and then gives the governor power to put regulations in place, to suspend, various statutes, various regulations. Um, a lot of local communities, counties, municipalities, towns also have uh, vested authority in the mayor, the town manager, the county commission to declare a state of emergency and also pass orders. So what we see is as many counties, municipalities, states as there are, we see all kinds of emergency orders that run differently depending on where you are. And that puts law enforcement in a place, in a spot. Um, Example, the Rhode Island State Police, because Rhode Island is so close to New York, 160 miles, the Rhode Island State Police have a checkpoint on Route 95, the main highway coming into Rhode Island from New York. They have a checkpoint with a weigh station with chase cars that initially were directed to stop every New York license plate. That got changed when the governor of New York, criticized the governor of Rhode Island, and that got changed. And now every single out-of-state plate is stopped. And if you don't stop for this first checkpoint, they chase you down and bring you into another checkpoint that's a little further up the road. Now, when you get to the checkpoint, they're not arresting anybody, they're not turning anybody away, but what they're doing is they're telling them that they have to quarantine for 2 weeks if they're coming to stay in Rhode Island. So again, that's the idea behind it. Now, the question is, under what authority does the governor have authority to suspend the Fourth Amendment? No. But is such a checkpoint reasonable under the Fourth Amendment? I guess that becomes the question. The ACLU is now complaining that it's not. And I suspect that somewhere down the line, not today, not tomorrow, it'll be after this is over, that law enforcement will probably, I'm not saying they're going to lose, and I'm not saying that there'll be any merit to the lawsuit, but I suspect that law enforcement will face a lawsuit as a result of these checkpoints that are occurring. I saw that I think it was in Massachusetts or Connecticut, last week. One of the states has they've left the golf courses open. They've closed about everything else, but they've left the golf courses open as an essential function. And but they are limiting who can golf at the golf course to state residents because they don't want people coming in from out of state and potentially bringing the virus with them. And so some folks got arrested for actually playing golf. They parked their car at a McDonald's. They jumped into a buddy's car that lived in that state, and they went golfing. And ultimately, they were arrested. Now, I don't think they were physically arrested. I think they were cited and released. But the fact of the matter is, there's a lot of orders out there, social distancing orders as well. Um, so again, we see a lot of this, and I think this is one that really hit the news. I don't know, the past few days, and it hit it pretty hard. Um, this was a retired police officer. I want to say Colorado State Patrol, so the state police, and he was out playing ball in a field with his daughter. There were other people in the field as well. Um, Now, I'm not saying I'm not making any opinions on this particular case. But ultimately, when he was uncooperative with officers who asked for his ID, he refused to give it to them, said he wasn't doing anything wrong. They were there to enforce social distancing. His side of the story, the news media side of the story, is that there was nobody else near him or his daughter, and he was throwing a ball to his daughter, who was more than 6 feet away, and he ended up handcuffed in the backseat of a police car. I will tell you that the officer then called for a supervisor who then ordered his release. But again, we've got to make sure that our officers are not confused by this because obviously there's a lot going on here. And when officers are told, "Hey, go out there and enforce social distancing," it's fine when you get the individuals who you say, "Hey, guys, you got to spread out more than 6 feet, or you're not supposed to be in this ball field. You're going to have to go home." And maintain residence at home because that's the state order. Um, what happens when they run into the person who's an outright refusal and digs their heels in, and now it becomes a war of words and stubbornness, and we've seen this in a lot of ways. In other times, not into this, but in other times, sometimes we call it contempt of cop because the person's not doing what they're being told to do, and the officer feels empowered by the administrative and executive acts of the governor to enforce these things. And now we get into these shoving matches, And so again, we want to try to avoid this stuff, and the best way to do that is I think to have officers understand that we do want to take steps to try to enforce and provide for the public health. But at the same time, it's got to be done with a tremendous degree of discretion. It's got to be done with a tremendous degree of soft hands, if you will, and try to avoid the exposure and the contact, both exposure to this virus. But then, make no mistake that just because we've got state authority and a state of emergency to do something, just because we are been told to do it by officials at the highest levels in our state or our county or our city. The fact of the matter is, when the lawsuit comes, the officer is still going to be the one that's sitting there down the line, and it's not going to be in the midst of everybody being concerned about COVID-19. It's going to be long after this is over. And as a result of that, minds forget quickly what was going on. And then the question becomes, is there any violation of the Fourth Amendment? I just put, I went on Lexis just before we started and just pulled up a state statute. Every single state has some statute like this, and certainly something that you should take a look at in your particular state to see what the governor has the power to do and how that then filters down to law enforcement. Again, every single state has some. There are some differences. In some cases, the governor actually has the power to pass regulations. In some cases, they only have the power to suspend provisions of statute and rules and ordinances and things of that nature. But again, you need to know what your officials have the power to do. But I mean, you can bet that most of them are are operating with legal guidance before they pass these particular acts, right? You know, I see a lot of departments actually um, putting out provisions, and again, this is just an example, giving officers clear guidance as to what they should do if he or she witnesses a business operating in contradiction to these orders, you know? Hey, I'm trying to support my local businesses, so I just share this with you. You know, I've got a little place down the street from my house, Giuseppe's, and I've gone there at least once or twice a week since they've started doing takeout, and all the tips go to the servers who right now are unemployed. And so I try to go there at least once or twice a week and leave a nice tip. And Giuseppe's, when I get there, a person you call in and they bring the food out to your car. The person has gloves and a mask on. They ask you not to get out of the car, just to leave the back door unlocked. They put the food on the back seat for you, all packaged up, and off you go. You pay by credit card before you make the order. I went to another place, which I'll leave the name out of, on Friday night to pick things up, and it was busy. It was Good Friday, and a lot of people were, you know, there's a heavily Catholic state. People were avoiding eating meat on Friday because of the Lenten season. And I will tell you that although the restaurant for sit down was closed, the pickup was inside the restaurant, and there had to be 50 or 60 people in their really small foyer. And yeah, some people had masks, some people did not. There were people sneezing, there were people coughing, and everybody, it looked like a death march. Everybody was like, what do I do? How do I pick up my food here? And then they were not running on time and all of that. So what does an officer do if they come upon this second business, or they get a call? You know, as I walked out of the place, I said, geez, I almost felt like I should call and say, hey, look, there's got to be a better way to do this. You know, I did mention something to the woman who runs it. I happen to know her. I said, you know, you're really probably not doing this the right way. And she says, yeah, I don't know what to do, you know. Um, so, so, you know, I think one of the things is we have to give officers clear guidance as to what the right response is. And I think the initial response should be at least an advisory response. Hey, the way you've got this set up is not working. You've got people too close together. You've got too many people in one place, and we need you to come up with a better system. And it needs to start right now. And I'll help you get people in line 6 feet apart, but they may have to be standing outside waiting to make their pickup. You know, what if you get a place that's wide open? What do you do with that? And again, you know, one of the things, and again, this is going to depend on your state or your locality, but it seems to me that if you've got somebody that's violating the rule that's been set down by the governor, by the county manager, by the mayor, with respect to opening their restaurant, having people inside, what have you, that the best form of compliance is their license, right? Remember, all of these businesses operate under a license. And so it would be good if the licensing authority and the governor or the mayor or the county manager or whoever's setting up these things don't set it up as a criminal infraction, but set it up as a licensing infraction so that the officer can, one, um, direct compliance, but at the same time, just you know, do a report for purposes of the license. And once the business owners know that, they know that, you know, potentially that puts them out of business if they don't have proper licensing. Hey, in-house changes, and when I say that, changes in the manner in which we operate inside our sheriff's office, inside our police department. Um, I call it occupational distancing, right? Because we need to do some occupational distancing. We see a lot of businesses, folks are working from home. Unfortunately, our first responders um, don't have that option. So, how do we limit exposures and the potential transfer between each other? You know, and obviously, one of the things is limitations on in person meetings. You know, and let's suppose that we have to have a meeting to decide how we're going to enforce things like social distancing, things like limits on businesses. You know, how do we have those meetings? And so we've got to find other ways to have those meetings. You know, for a while there, I was talking about this Zoom. Zoom seems to have really caught on, Unfortunately, I don't know if anybody's following this, but Zoom had. Let me think if I got the number straight. I think they had 2 million folks using it. This Zoom, it's kind of like a Skype on steroids. And now they have 200 million people using it. I think that's the number. And I could be wrong. Could have been that they had 200,000 using it. And now they got 2 million using it. But they had this tremendous upswing and they weren't prepared for it. There's actually some calls for some congressional investigation of Zoom. So if you're using Zoom, it's again, this is a little bit of an aside, but something to think about. People are able to easily hijack Zoom, and that's the problem. There was one case that was cited where a guy was actually doing his PhD dissertation by Zoom. He was presenting. His whole family was logged into Zoom, and suddenly somebody started writing racial issues and drawing graphically sexual things on the blackboard behind him. And it was somebody that had hijacked the meeting. So, but we've got to find ways to limit those. A lot of agencies making changes to roll call. A lot of agencies have, for years and years, we've had formal roll calls where we go and we stand in a group in a roll call room, a briefing room, what have you, sit next to each other. Sergeant gets up in front and gives us the assignments for the night. We see a lot of agencies changing that, some doing it out in the garage where they have a lot of room so officers can stand 6 feet apart. We see some agencies that has suspended roll call briefings and instead have the officers come into work and respond directly to their vehicles, disinfect the vehicles, and then go on the road. And if there's any passage of information that happens over a communications channel once the officer's in the car. So we see some changes there. We see a lot of agencies that do have take-home cars, and in those agencies, we have officers reporting directly, calling into service from their cars. So again, some changes in that vein as well. Single officer units only. We see a lot of agencies that double up. There's a lot of agencies that don't, obviously, but a lot of agencies that double up officers have moved to a single officer unit only policy for the time being, so that the officers aren't sitting, 2.5 feet apart, whatever the distance is across a vehicle. In some cases, probably less than that, and potentially, because of the long-term uh, physical presence with each other, a greater likelihood of infecting each other if, in fact, one of the officers is asymptomatic and is at work. Because remember, a lot of this, the person is asymptomatic for a period of time, or even maybe some are asymptomatic throughout. We see, in my mind, we see the United States has some really large numbers of people that are testing positive, but um, CVS has put up a place um, near their home headquarters, and CVS is doing drive-through testing, and they can do, I forget what the number is, but they can do like 1,000 people a day through this drive-through testing. It doesn't require a doctor's referral. The test comes back in 3 to 4 hours, and all you got to do is make an appointment. So they get this line of traffic all day long. So the more people we test, the more people we're going to find out have this, because a lot of people, from what we're being told, are asymptomatic. Hey, a lot of agencies with officers currently in field training, and I've seen this in some of the big agencies around the country, that they're suspending the field training operation because, again, that puts officers in close proximity to each other in the vehicle, and lengthy exposure if one of them is asymptomatic. So in some cases, they're saying, hey, if this officer is just toward the end of field training, then we might allow them to, proceed directly to riding on their own. Otherwise, we use them for other duties where they don't have to be so closely supervised. So again, we're seeing both of those, but we're seeing a real move toward holding off on field training. Police academies, I've been watching over the last few weeks that police academies that are in session right now with new officers are taking a number of steps to make sure that the officers have social distancing while continuing that academy, if it's continuing while this is going on. See a lot of agencies suspending training, even state mandated training. They're suspending it for a number of weeks and postponing it until such time as this passes and go into an online training only. So again, we see that happen again. I would invite you to pull up our links on our website after. There's a number of, I think I did 5 or 6, I think 6, maybe even 7 sessions just on COVID-19. They're short. I think the longest one is 20 minutes, but most of them are somewhere between 5 and 15 minutes, and cover different aspects, some of which we're talking about here. But then I just did one on the new Supreme Court case that came out last week, Kansas versus Glover, and we've because of what's going on, we've decided to share that nationally as well. So feel free to take a look at that. It's some online training for this particular issue, and then some online training for our regular business as well. There may be some agency positions that can be done remotely. Some agencies, for example, have telephone reporting where the officer calls in their reports, and they have a room where transcriptionists sit and do the telephone reporting. Maybe those can be set up from home. Maybe some of our clerical positions can be set up from home. Payroll, human resources, things of that nature can be set up from home for the time being, because that cuts down exposure of everybody to this particular virus. So again, we ought to be looking at that if we haven't done so already. Hey, I see a lot of agencies that are having officers screen themselves, or they're doing screening before the officer comes on shift. And again, they're looking for temperatures, temperatures over 100 degrees. Now, I noticed that this particular agency that I took this from, it's set at 100 degrees. And I don't know why. Again, I probably should, but I think the benchmark is 100.4. Is the benchmark that I've seen in most places. And they're hard to come by now, but even the thermometer that you point at the forehead, the no-touch thermometer, works. And so we see a lot of agencies doing this. Where there's a person has potentially been exposed, but is showing no signs, one of the suggestions is that their temperature be taken twice during their shift. And that's some recent recommendations over the last week or so. But to allow those first responders to continue working, because the necessity of first responders is recognized. Believe it or not, I have one of those forehead thermometers in my house, and I'm a little losing my mind. I check myself once a day myself to see. Hey, some other things officers can do to avoid exposure, limiting interactions. And again, we are social beings, and I get that part, but this is a time when we have to be cautious. So, we do see, a lot of officers, and you guys know, we park the cars in opposite directions, sit window to window, and talk about business or things outside of business to pass the time. We have to limit that stuff right now, because obviously, if you're window to window, and I can remember as a young cop, we used to try to see how close we could get the cars to each other without actually hitting each other, right? And so you're sitting window to window to shoot the breeze. We've got to knock that stuff off for the time being until all of this passes. See a lot of agencies limiting the number of officers being in the station. A lot of agencies have a break room where officers go in to have their dinner. Maybe they brought their dinner to work, or maybe they picked up takeout, and now they've got a place to eat. They don't live in town, so they're going into the station. A lot of agencies saying, all right, well, you can still go in the station and eat your lunch, but a couple of things need to happen. One, only one officer at a time. And two, you've got to, use cleaning disinfectants after you eat, so that, if potentially, God forbid, you're asymptomatic and you just sat there and ate, you don't pass it on to the next person that comes in. Again, I mentioned this already, breaking the jurisdiction up into segments with crossover limitations. So, I mentioned that agency that took their mobile command post and put it on one side of town, and broke their agency into 2 different police departments. As a matter of routine course, they're not crossing over from one side of town to the other side of town, because again, that would defeat the purpose. So it would only be in the utmost emergency where they would do that. Um, hey, I see some agencies taking their administrative staff, taking some of their investigators, particularly their investigators that only do proactive work, and they're actually setting them up as an additional squad so they're ready to jump in should they become shorthanded because of quarantines or because of illness. So again, something else just to think about, some of the things we can do to avoid that. Again, this one's cut and pasted out of a policy, and this one goes to both on duty and off duty. Each patrol squad should be quarantined from the other squads. And again, here's the theory. The minute you get an intermingling, if you get one officer who, and let's take it to the extreme, tests positive, then arguably all the other officers that had contact with that officer, particularly if it was close contact, may end up under quarantine. And now you have a number of officers who can't come to work. Or you have a number of officers that actually all test positive and now they can't come to work. So again, the reason why you're trying to prevent this intermingling is for that very purpose. Um, Again, limiting intermingling off duty as well. We see this is again right from an agency. It's somebody thinking strongly about, all right, how do I make sure that all of my officers don't get affected? I happen to know this agency, um, and it's yeah, they actually had an officer and his wife that were tested positive for COVID-19. It's a Midwest agency, and they actually had a husband and wife that tested positive, and so they then had to look at anybody the officer had contact with. Remember, one of the things is if you get an officer that tests positive, you're going to have to start following that officer's contacts of people that officer had contact with at work to see potentially what the origin is of their exposure. You may also have to start looking at all of the potential persons, including your own officers, your own staff, as well as arrestees, reporting parties that officer had contact with to let them know that they've been exposed as well. Um, so again, we want to limit these officer to officer exposures as well. Hey, let's talk a little bit about contamination and decontamination. One, obviously, the way to avoid exposures, and everything's telling us this, is personal protection equipment, right? So, goggles, uh, respirators, biohazard bags to throw stuff away in, hand wipes, coveralls, white nitrile gloves with black lining. Obviously, this is one particular agency. That's what they're buying. Um, there was a few weeks ago, or maybe 2 weeks ago, there wasn't a suggestion that officers wear masks all the time. Now we see some suggestion that everybody wear some kind of covering when they're out in public, and certainly that applies to law enforcement officers. There are, it's interesting, but I had a pharmacist tell me the other day that is not having any trouble getting the surgical masks, but he's paying a lot of money for them. So there's an expense involved, but he's able to get them. He's not able to get the N95 respirators, but he's able to get something similar, maybe not quite as good, but these K95 masks that are a little bit different. The fitting may not be exactly the same, but they do accomplish quite a bit. So again, we ought to be wearing this stuff. We ought to be covered up particularly when we're on calls. And the masks serve a couple of different purposes. One, they serve the officer from infecting somebody else. Let's face it, some people when they talk, they're spitters. They might sneeze, they might cough. So it protects when the officer or the subject that is potentially infected is talking or sneezing or coughing. It potentially protects the particulate matter from flying from the officer into the air and becoming airborne and infecting somebody else. I read an interesting piece by a doctor who said the other thing that he wears a mask all day because he finds that when he wears a mask, it trains his hands not to keep touching his face. Because one of the ways we at least the contamination is working in this area is we get matter on our hands, and then we take at some point and touch our nose, our mouth, or our eyes, and that's how it's passed. So again, by wearing a mask, we avoid that. By wearing the goggles, we avoid that. I even saw one doctor said, "Hey, look, um, eyeglasses are not ideal, but they're better than nothing at all." So even officers making sure they get their sunglasses on or what have you, if they don't have the goggles available, would be better than nothing at all. Obviously, officers want to be concerned about when they're removing this stuff. You don't want to infect yourself as you're removing the very thing that you put on to protect yourself, right? So when we take off the gloves, obviously, we take them off one at a time, turning them inside out and turning them, putting one inside the other as we turn it inside out. It's pretty easy to do. Same thing with the mask. We want to take the mask off in a way that we, pull it off from the elastics behind the ears and don't touch the front of it or the inside of it, particularly the front of it, because obviously that would be if we were um, had protected ourselves from some kind of particulate matter from somebody else and it was on the front of the mask, we don't want to then be touching it. So again, those are things we want to make sure we do. Hey, cleaning. Obviously, work areas need to be cleaned. In the officer's case, in most cases, the work area is their vehicle. But we want to do this across the board. Our corrections people, that's a huge issue. To make sure that the jails are clean, to make sure that they're not exposed by unclean surfaces. And again, so we want to make sure things are clean. Our dispatchers, the dispatcher before you sits in close proximity to that mic. Maybe you share that mic. Maybe not. Maybe everybody's got a different headset, but you want to make sure that everything is sanitized before it's used. In talking about potentials, I was talking, this goes back a couple of weeks ago when there was virtually no hand sanitizer available, and maybe some of you are still running into that. And one of the things I said was, well, maybe we ought to get, we did this with pepper spray to decontaminate from pepper spray. We made gallons of water available and put them in the trunks of police cars. Why not consider something like that? And somebody said, well, geez, you can't even get your hands on a gallon of water. All right, well, let's take a cooler and put it on the front seat of the police car and seat belt it in with some water in it, and then have the drain from the cooler that sits on the bottom of the cooler facing the exterior of the door. And after a call, the officer takes and washes his hands with soap and opens that drain on the cooler and rinses off, right? So we should find some ways to do that kind of stuff. And I will tell you, this is an area where I think we should continue even after this ends. When we know that officers have the potential from getting sick or getting illnesses from touching people, from touching surfaces, then we ought to make it a priority. Hand washing, hand sanitizer, we ought to make that a priority that continues on even after we get through this particular time. Because, officers do get involved with a lot of people that are high risk people for all kinds of illnesses. So we ought to be taking this into account. Obviously, wearing gloves on a regular basis is a good thing, and I'm not talking about the gloves that we sometimes see officers wear that they put them on and put them on every shift, and then the black gloves. I'm not talking about that, and I'm not criticizing that. I'm just saying that if you get germs on those and then you take them home and you put them on the shelf or you put them on the front seat of your car and your kid says, oh, those are daddy's gloves, I want to try those on, or those are mommy's gloves, and the next thing you know, those gloves can be full of germs too. I'm talking about the disposable gloves that we get rid of after the issue. I think right now, one of the things that I suggested is we go to flex cuffs as well. For the simple reason that handcuffs have a lot of nooks and crannies on them, and as much as we try to disinfect them, they may not be disinfected. Flex cuffs are one and done, right? We use them and then we simply cut them off and throw them away. So I think, from that standpoint, that flex cuff sort of be a staple of our business right now. Hey, there's a number of agencies that have put out definitions of what an exposure is and what is not an exposure, what's a potential exposure. And I'm not going to read all of these, but it seems to me that most of the policies out there are making some distinctions, and they make a distinction. Did the officer have protective equipment on? So if the officer has contact with somebody who is confirmed COVID-19 and not wearing protective equipment, then the officer has an exposure. Same thing. If the officer, though, is maintained 6 feet and hasn't maintained contact for 20 minutes, then that's not an exposure, even if they weren't wearing it, right? If they were in contact, though, for 20 minutes and was within 6 feet, then it is an exposure, right? Non-exposure. The officer does have their personal protection equipment on, or they make contact with somebody who's confirmed COVID-19, but they maintain the 6 feet or greater distance, you know? So again, we're distinguishing different exposures, right? And there's different risk levels for exposures, right? Low risk, being in the same indoor environment with a person um, uh, for a long period of time, but not meeting the close contact. So in other words, you're not within 6 feet, or you've got personal protection equipment on, right? That's the other possibility. That would be a low risk. But if you were seated in the same patrol car with them, with a partner who's got COVID-19, that would be a medium risk. If you were confirmed to have direct exchange of secretions, the person coughed in your face, sneezed in your face, something like that, or you lived in the same home with somebody who was confirmed COVID-19, then that would be a high level risk. So again, different level risk depending on what the exposure were. I stole this, so I've changed it a little bit, but I think that every agency should work with their medical officer or health director or whoever to come up with a flow chart. If this, then that, right? And it may be different depending on your particular circumstance, but certain things shouldn't be. Obviously, if the officer's exposed and doesn't have proper protection equipment on with a confirmed COVID-19 patient, then there's some steps that should be taken. Now, the steps may not be the same here. It may be a case where, um, the new suggestion is that, the officer monitor twice a day their temperature, but can continue working. But obviously, if an officer's confirmed COVID-19, then they can't continue working. And there has been some movement for quicker testing. So again, but I think that everybody ought to identify for their agency what the steps are going to be taken. And again, if they're exposed and they're wearing proper protection equipment, that's one thing. If they're exposed to confirm COVID-19, that may be a different step. When they don't have proper protection equipment on, that's a higher level. And when the office is confirmed positive. So what steps are going to be taken under each, and what's the work status going to be taken under each? What's the health status going to be taken under each? What does the agency need to do if you get an officer confirmed? You want to try to figure out how was the officer exposed? Who else did the officer expose? So you want to do that tracking piece, the agency, because you're going to be in the best position to do that. And make no mistake, if you get an officer that's confirmed positive for COVID-19, and then they've arrested somebody, and then a week later that person gets confirmed, it may be that that's the person that exposed your officer, but make no mistake that somewhere down the line you may see that person try to allege that your officer actually exposed them, and take steps to try to bring an action against your agency in that case too. So we want to make sure that we are taking reasonable steps to protect the officer, but also to protect anybody the officer comes into contact with. You know, one of the things that I say about changing behavior, if you won't change your behavior to protect yourself, because we know officers don't always think about their safety. And I'll tell you, that's an attribute that I love about you know, the members of my family that are in law enforcement and all of my law enforcement family that I've adopted around the country, is that officers don't always consider their safety. I think in this case, because of the potential of bringing this home to your family, I think that if you won't change your behavior to protect yourself, then change your behavior to protect those people that you're going to come into contact with, that you've taken an oath to serve and protect. You want to protect those people from potential exposure that you could pass on, and that includes your family, as well as the people you come into contact with at work. So if you won't change your behavior because you don't think about your own safety, and I know a lot of you don't, and this goes with respect to a lot of things in our business. It's the thing I love about law enforcement, that they're willing to take action, they're willing to take the risk and assume the risk to protect others. Um, but in this case, you've got to protect yourself in order to protect others. So I think that's the kind of philosophical piece that I'll close with. So with that, I invite you to you know, download all the free training that we've done over the last few weeks. And a lot of it relates to this COVID-19, but there is also some that relates to, I think, probably going to be the only big Supreme Court decision on law enforcement this year. And I've done a video that goes along with the article that I wrote on that. I think the video runs 6 minutes, so it's a nice little roll call piece to keep officers updated, and it was a really good case for us. So with that, I'm certainly here to take any questions, but thank you for showing up. Thank you for all you do out there. Please be safe. Please take this seriously and help all of your folks take it seriously as well.
Thank you, Jack. If everybody wants a minute, I'm going to share out my desktop and show you how to access the course materials page and show you how to access the area where you can get your certificate of attendance. So bear with me for just a second while I do that. All right, so should be seeing my desktop now, and let me open up a web browser. And let me navigate to our course materials page. And I'll give you that address again in the chat room in just a minute, and we'll put it on our exit slide. That should be a dash. Whoops, not quite. Here we go. Let's try that. All right, so the first thing we're going to have to do is put our password in here, and I'll give that to you again. That's the same one I've been putting in the chat room so far this morning. 1420. Let's see if I got it right. C1249414120. Hit enter. And here is our course materials page. Over here on the right, we have a copy of Jack's PowerPoint as a PDF. So you have that to refer to. We also have that same PowerPoint turned into a PDF, but 3 slides per page with some spaces next to them to take notes. Going a little further down on the same page, we have the area where you will put in your information. Once you do that, it'll ask you just to certify that you viewed the webinar in its entirety. After you do that, it will give you a link to download or to print your certificate of attendance. It's got the course name on it. It's got Jack's name as the instructor. Obviously, it's got 1 hour credit for your training today. If by chance you get to that point and you cancel out of this, don't worry. You don't have to go back through and apply for a new certificate. If you give it just a minute, the email address that you just used when you signed up for that stuff, you'll receive an email to that address that will have a link to download your certificate. So once you fill that out, you'll get that certificate and you can then access your certificate through that link. So I'm going to put up our exit slide there. That has our course materials page on it once again. That has our password on it once again. And as I stated earlier, after we're done, give me a couple of hours to get our video finalized, and you'll get a link that will have, you'll get an email rather to the email address that you used when you registered for this webinar, and that will have the link to the recording. It'll have the password for the recording. It'll have the link to the course materials page, and it'll have the password for the course materials page. So as Jack said, we really appreciate your attendance. Please check out the LLRMI site for all the materials that he sources on there, as well as our other upcoming training opportunities. I know all of us have had to cancel our in-person training, but we do have a lot of webinars coming up on relevant subjects. So please check that out. As Jack said, I always close my webinar spiel with please stay safe out